Member for North West Central.
Thank you, Mr Acting Speaker. My grievance is to the Minister for Health. Minister, the seniors of Carnarvon and the community as a whole need your assistance. We have an aged care facility called Poinsiana Lodge located at the Carnarvon Hospital campus that is now non-fit for purpose and it needs to be replaced sooner rather than later. It is currently growing at a waiting list of the elderly from Carnarvon. The Gascoyne and Murchison that are seeking replacement at Poinsiana Lodge, but either cannot get a placement or are unable to be provided with the information of when a placement is likely to be available. It currently has an official operating capacity of 15 beds, but is overflowing into general wards each night, and then patients are transferred back into the lodge during the day for care. There's also been numerous assaults on the lodge residents by other fellow residents suffering from severe dementia that is causing untold stress on them and their families. Minister, I ask you that you immediately move beyond the petty finger pointing and the retributions currently being levelled against members of the previous government and look to reallocate the entire $16 million of funding for the 38-bed aged care facility that was planned and approved to be built at the Carnarvon Hospital campus. A new fit-for-purpose 38-bed facility located at the Carnarvon Hospital campus is exactly what is required. It is only the aged care facility and is only location that the Carnarvon community wants, regardless of what some senior councillors in the Shire of Carnarvon may present to you. The WA Country Health Services knows this, as does the Health Department. I understand the small number of senior Shire councillors have expressed a desire to you for the aged care facility to be located on land far away from the hospital. You may not be aware that the community does not support this model that will benefit one organisation at the expense of the entire community. The Shire has undertaken no community consultation to understand what the needs of the community are. In fact, the very Shire councillors that have been driving this poorly informed concept have failed to attend a number of other community meetings about aged care, where the clear desire of all attendees, the elderly and their families, was to have a new permanent care unit located at the Carnarvon Hospital campus. The concept being driven by this small cadre of Shire councillors has held meetings with various ministers of your government, falsely promoting the idea that the view that they are in favour of is what the community wants, and in some cases I'm informed at least one councillor has failed to inform the attendees of the meeting that he has a direct conflict of interest in moving the aged care facility of his choice to a site which benefits his organisation. Community members have been bullied and abused by these councillors when objections against their concept has been voiced, and I have had one Carnarvon resident in tears in my office immediately after leaving a meeting with the acting Shire CEO and the Shire President and Deputy Shire President after having faced terrible abuse and intimidation. There has already been close to $1.5 million spent on the pre-construction demolition work done at the Shire of Carnarvon Hospital campus by the Country Health Service to make ready the area that is preferred location for the permanent care unit. If the Minister approves the relocation of the PCU to the Brockman Estate location, all of this will be wasted. The public commentary coming from those Shire councillors supporting this relocation is that it will provide low-medium care. As the Minister as well knows, the preferred model is for services being provided for ageing in the home at that level, and that a fully equipped permanent care unit is to provide the types of care that is not able to be supported in the home environment in most cases. Minister, I ask you to be upfront and transparent with the people of Carnarvon community about your dealings or that the Health Department staff with the Shire of Carnarvon. I ask you not to give any weight to the submission that the Shire is about to deliver to you without asking them to show you a level of public consultation that they undertook to reach their conclusions. Next week, the Shire is holding a closed special council meeting to discuss the submission to you. What possible reason could the Shire Carnarvon Council have for holding a closed session to discuss such an important topic as aged care facility that the Carnarvon community wants without allowing the community members to listen and participate in the discussion? Minister, I ask you to find the resources to reapply the full $16 million to complete the 38 permanent bed care unit at the Carnarvon Hospital campus. I'll do my part to help you lobby the federal government for a contribution to the facility. I'm just asking that you consider the information provided to you from the WA Country Health Service that the $10 million will only get you 22-bed facility, which will be filled immediately and have no capacity for future growth and demand. The waiting list is growing, and the statistics for the local and regional demand for aged care and permanent care is that there could be 20 more patients seeking this type of facility locally. We ask the elderly to age in their homes, to remove the burden to the state and provide them with a comfort in the familiar surroundings where they have lived. We know that they want to live locally and see the end of their lives locally when that time arrives. We're just asking you to provide the most appropriate facility for them to do that when it comes to leave their home, to move to a permanent care unit. We ask you, don't force them to be sent to other communities far away from their families and friends. As I said, Minister, the discussions that you or your department are having with particular councillors, I don't believe it's all the Shire councillors of Carnarvon, but particular Shire councillors who are intimating that they would like to move the aged care facility to another precinct. Carnarvon needs a high-end aged care facility. We have gone through this debate over 10 years ago. We allocated $16 million of royalties for regions money, $16.6 million to build a 38-bed facility, of which $1.5 million has already been spent. In the times when you say that it's tough economic times, don't lose that $1.5 million. Ensure that we can build a 38-bed facility by reinstating the funds needed, and ensure that the community's wishes that the 38-bed facility goes to the Carnarvon Health Campus site. Thank you, Minister.
Minister for Health.
Acting Speaker, thanks very much. And can I just thank the member for his grievance today and acknowledge his advocacy on the issues with regards to aged care in his electorate. And it's interesting to note, I think the member made the comment that this has been going on for some time, and it is a journey. It's a journey that I've been on as well. The Ageing in the Bush report developed by Regional Development Council sort of identified an ageing population in regional Western Australia is an important priority, and one which involves contemporary and innovative ways of providing aged care in the communities in which these people live. And I acknowledge the comments by the member which says that people should have a right to be able to age in the communities in which they live, in familiar surrounds and in a way which is appropriate to their needs. I think we all support that principle, and it's important that we make sure that that principle is uppermost in our minds when we consider these particular issues. And there is an identified long-standing and increasing need in Carnarvon for contemporary residential aged care facilities due to the ageing population. And in addition to that, the existing 16-bed facility, which is now over 50 years old, and I've been through that a couple of times, and I acknowledge and agree with the member that it's a facility that's well and truly in need of replacement, not repair. And over the past decade, the Shire of Carnarvon has essentially been unsuccessful in attracting non-government organisation to provide the aged care facilities in that town. In 2009, Southern Cross Care received a Commonwealth approval to establish a 38-bed aged care facility and $10 million worth of capital funding from the Commonwealth towards the building costs. Unfortunately, in 2010, Southern Cross Care advised that they were unable to proceed on the basis that they deemed the service was not financially viable given the level of Commonwealth recurrent subsidies. Subsequently, they relinquished their $10 million capital grant back to the Commonwealth, and as is the way, and sadly is the case in so many country areas in Western Australia, the WA Country Health Service have been relied upon as the provider of last resort. As the member noted, that there was a notional allocation of $14 million in the 2013-14 state budget towards the redevelopment of the aged care facilities at the Carnarvon Health Campus site, and in unfortunately, on the 7th of September 2017, the state government, as part of its review of the royalties for regions program and the need to get the state's finances back under control, we took the tough decision of reducing that funding from 16 million to 11.577 million for the Carnarvon residential aged care facility. Now, these are decisions, Mr Acting Speaker, that aren't taken lightly. They are difficult decisions and ones that were taken with all the available evidence before us. And as the member says, the Shire has been actively advocating for the development of residential aged care facility on a different site away from the Carnarvon Health Campus, and the WA Country Health Service has been working and is looking to engage with the Shire just to see how that particular proposal stacks up. And I myself am on a bit of an educational journey in terms of understanding the parameters and the dynamics of that particular proposal. In particular, if we are to contrast it against the unsuccessful bid by Southern Cross Care back in 2009-10, well then you'd want to make sure you proceed pretty carefully, pretty cautiously in relation to that. So WACS has communicated to the Shire that if WACS were to operate the facility, and due to economy of scale and efficiencies and recurrent operating costs, it is more feasible to build these residential aged care beds on site at the Carnarvon Hospital, and more overall beds can be achieved than if they were built off-site. Redeveloping on-site will benefit from far greater economies of scale with regards to support services such as catering, maintenance, clinical availability and administrative support. It's neither financially viable nor efficient for WACS to operate the residential aged care facility, which is not co-located at the Carnarvon Health Campus. The Shire advised WACS that they would be seeking a meeting with myself and the Minister for Regional Development and WACS to progress the Carnarvon residential aged care project, and I look forward to hearing their views and engaging with them in relation to that. I'm keen to make a final decision on the location of these residential aged care beds, as the main point is not where the beds are located, but rather that we're actually getting on and doing it. And I think that's an important observation to make. Mr Acting Speaker, I will, if with the member's indulgence, just sort of observe that we are discussing an area of service provision which falls wholly and solely in the purview of the federal government. And as we often find in the case of primary health care, residential aged care, and a whole bunch of areas that the federal government's responsible for in these country areas of Western Australia, the federal government are simply missing in action. I wrote to the Federal Minister for Aged Care, the Honourable Ken Wyatt, to sort of say, well, if you're prepared to give $10 million to Southern Cross Care, why don't you give it to us to help us develop this project? And he sort of said, glibly wrote back saying, but you're not an NGO. But the fact of the matter is that the state government is the only provider of last resort in a lot of these smaller communities. And so what you actually want is the federal government to take a more collaborative and innovative approach to these things to make sure that we get the services to these people that they so richly deserve. It's unfortunate that the federal government has taken that particular approach, but I acknowledge the offer from the member in terms of continuing to lobby the federal government in relation to these matters. I'm keen to resolve this matter as soon as possible to make sure we get a viable residential aged care facility, and I look forward to working with the member to make that happen.